Well, hey, thank you guys so much for joining me this evening. I'm Dr. Jordan Kane Smith, and my goal of creating this webinar is just to help demystify a lot of the TMJ challenges that a lot of you guys face. A lot of my patients come in with a lot of questions. And this is kind of a conversation I have with a lot of our patients, and it's kind of a consistent one. So I just thought, hey, I'm going to start putting this out and hoping that maybe I can help you guys understand a little bit more about your oral health. So if you're suffering, if you're having a lot of clenching, grinding, waking up with a lot of fatigue in your muscles or headaches, migraines, things like that. I hope that this quick webinar will teach you a little bit more about your own health and maybe what's causing you to suffer through some of those things that I really hope you don't suffer from. So we'll be going through this presentation and talking about some of the things that we most commonly see. I'm going to jump through. I don't want to take a lot of time. I've got my copy. I hope you're having a good night. I'm pumped. I'm ready to talk through TMJ. If you have questions, feel free to leave those, please, in the comments as we're going through, and I'll get back to those and I'll answer those comments. So please do that, and then I'll be trying to do this every month. So if you have questions, I'll try to hit those again in the future. But today we're going to go over why your jaw hurts, the 3 most common causes that I see with our patients that have TMD or temporal mandibular disorders, and exactly how we treat them. So that'll be the goal here. I'm going to jump through some of these presentation titles, but first and most importantly, I want to tell you a little bit about myself and my background. So again, I'm Dr. Jordan Kane Smith. I started this practice, Breathe Modern Dentistry, back in 2016. I graduated from OU Dental in 2014, so I guess that means I've been at this around 11 years. Time is flying. But I founded this in 2016. I actually began treating TMD in around 2018 because I was patient zero. So I was actually suffering a lot from TMD myself. I was at a point where I remember waking up one morning and I thought I was clenching my teeth so hard I was going to break my teeth in half, and it scared me so much. And not having the answers and being a doctor and not knowing why my patients suffered, why I suffered, I kind of got fed up with the unknown, and so I just struck out to learn. And so I've studied with a lot of different postgraduate courses and universities, so to speak. So I won't get into the whole history. It's been a lot of different places where I've learned multiple things. So I learned about the bite in one place, I learned about the jaws and the development in another place, and I learned about neuromuscular dentistry in another place. And so over the years, just kind of compiled all these different angles to what's happening in our mouth and in our face to finally get to a point where we are definitively able to diagnose a lot of our patients thoroughly, treat them thoroughly, and get them out of pain consistently. And so we're really proud of that. But anyways, my hope is to share some of those insights with you. I put some pictures down here because my journey, as I mentioned, I'm patient zero. And what that means is I was having a lot of pain, a lot of suffering. I've had braces twice. But in this picture, I'm actually doing, jumping through. In this picture, I'm doing some TENSing, some neuromuscular dentistry. We'll talk about that in just a minute. Here you can see I kind of had a gap again where I had braces and then I had teeth taken out. And here I made more space for them. Here I'm actually getting braces on. Here I'm getting full mouth reconstruction. And thankfully, I'm out at the end of that road. But I share that story because I want patients to know I've been through all of these things. I've experienced nearly everything that I can do to help a patient, between braces, full mouth reconstruction, orthotics. We'll talk about all these things, but I've been through all of it. So I think having the empathy and the sympathy of having lived that journey is really what helps me relate to you all. And I do enjoy that part of being able to do what I do. This is the roadmap for this webinar. We're going to talk about what TMD is. We're going to go over the 3 main causes. We're going to have some case studies at the end of patients that I've treated, that we've helped, and then we'll go over some FAQs that I hear consistently when we're talking about TMD. So let's jump into it. Grab your coffee, grab your popcorn, and let's run through these things. So first and foremost, what exactly is TMD? So in simple terms, it's just a problem with the jaw joint or the muscles that control the jaw movement. I might extend that and say it's a problem with the teeth as well, and we'll talk about why. But here's the most common symptoms that you might relate to. 1 is jaw pain. 2 is clicking, popping, grinding sounds in your joint, your TM joint there. Difficulty chewing. I've had a lot of patients that can't even chew like a hamburger. Limited jaw movement, that's part of that, where they can't open wide enough. Frequent headaches, for sure, probably the number 1 kicker. And that often originates in the jaw muscle. So a lot of times it starts here, starts in the back of the neck, radiates up over the forehead. Ear pain, ringing in the ear, dizziness is actually another common symptom of TMD. Get a lot of patients from ENTs that are like, your ears are fine, go see a TMD doctor. And then facial pain, just overall discomfort in the face, the shoulders, the neck, and of course neck and shoulder pain. And one of the most common questions I do get is the neck affected? Is that part of TMD? And I'm like, oh my gosh, yes, because all of these neck muscles that you see in this photograph here, the SCM muscle, the scalene muscles, the trapezius muscles, the masseter muscles, and the digastrics and some of these others, very responsible for how our jaw moves in space. So our neck is highly involved in where this guy lines up. And so if you have TMD and a lot of tightness in these muscles, you'll have tightness in the neck muscles as well. So keep that in mind. A lot of chiropractic work is the responsibility, or I should say the outcome of TMD and the bite and the jaws, believe it or not. So why is TMD so confusing? It's a very confusing field. Overall, this is a little figure that I found online, and this is almost like a roadmap of how to treat it, how to diagnose it, and it's almost so complex I'm not even sure I could follow this. But it really comes down to proper diagnosis because there's so many different reasons that we can have TMD. It can kind of start from the neck up, and it can go from the neck down, of course. And there's other things like car wrecks and whiplash and other things that can affect this. But overall, again, we're going to be talking about the 3 most common causes that I see that are not injury-related and trauma-related. But proper diagnosis is absolutely key. So that takes a long time to kind of figure out. There's a lot of patterns to pick up on. There's a lot of issues to pick up on that over time you start to see a pattern. But at the end of the day, you're different than everybody else. And so it's not a one-size-fits-all scenario. All right, so next we're going to talk about the TMD triangle. Now this is kind of something that I've created, but over time I've noticed a pretty consistent outcome of TMD. And what I mean by that with temporomandibular disorders is that a lot of times you may have your teeth wearing apart and you're grinding and clenching, your teeth are just getting obliterated to where your teeth are flat like pancakes. But your joints are fine and your muscles are fine. Other times it may be that your joints are highly damaged and degenerating and patients are having a lot of issues here and a lot of inflammation in front of the ear, but their muscles are fine everywhere else and their teeth are okay. And then other times it becomes muscle pain where the muscles are just chronically inflamed and irritated from having to work so hard to align the bite. And you may be having a lot of headaches, migraines, but your teeth are fine and your joints are okay. And I'd say most of the time it's a combination of all 3, but one tends to always kind of take the cake for each individual. Not really sure why, but that's just kind of what I see. But over time, these 3 things kind of work hand in hand, and there's always a relationship between them. So I'm always looking at those 3 things and trying to figure out where exactly it's breaking down with each and every individual that we're treating. So that's TMD. I'm going to go a little quick tonight because I do want to get home to my family as well. But I also don't want to bore you. So we're going to jump now into the 3 main causes and how we solve those. The first one is going to be the most common thing I see, and that's going to be occlusal muscle disease. And that's a fancy term, but it's been around for a long time. And it just means poor occlusal harmony. That just means poor harmony in your teeth and the bite itself. That's creating muscle or affecting the muscle function of our chewing system. So when our teeth are banging together, especially our back teeth, it triggers an actual neuromuscular response or an active response in our muscles that you don't control, almost like a blink synapse. So if I blow in your eye, you blink. You don't really have to do anything. You don't think through it. You don't decide to blink. You just respond. Teeth are the same way. When you bang teeth in a certain way, it actually causes the muscles of our chewing systems to overcontract. And that's the reason for a lot of clenching and grinding. So this is exactly why we have teeth, and these little pink dots here are the reasons or where we want to hit our teeth is a better way to put it. And teeth, believe it or not, have an exact spot they want to be hit. And the reason that is because the bone is kind of designed to hold our teeth in a way that we can compress the root and the tooth. And that is absolutely fine for the tooth. But if you compress the tooth in a way that causes it to rock, you're going to create some stress. And in that ligament that runs around our roots, it's this little green spot here. There's a lot of nerves in that. And if you compress that nerve for too long in a certain direction, that's what creates that muscle tension. And this is just a little roadmap of that actual anatomy or neuroanatomy that they've actually traced out. And so I don't want to go back to my dental days, but we used to study things like this, but this actually traces exactly how those nerves from the teeth go all the way back and create that response in our nervous system. So highly documented, highly researched, but we know it's there and we know it happens. I use this analogy a lot with a patient because really when we bite together, again, we want our teeth going straight into the bone the way that they're designed to be held by that bone. And if we are biting and causing our teeth to hit together in certain ways because maybe they're out of alignment, we're hitting it almost like a nail on or a hammer on a nail, and we're going to bend that nail. That's going to create damage to your teeth, but we're also going to create stress on the foundation. Just like that nail would bend in the board, we're often going to see detriment to the bone, and that means a lot of things like recession. We're going to have abfractions, which is a term for kind of notching. I think I have an image of that in this next screen. So this is called abfractions here, and you can just see where we're getting notches at the base of these teeth, and it's just basically from being flexed so hard a certain way that it begins to break down there at the neck of that tooth. But the most common symptoms of occlusal muscle disease is going to be tension, especially here in this masseter muscle, right on the side and it usually radiates down the neck from there. And most patients will report waking up with this, where they just feel like they've been clenching all night, and their neck and their joints here, everything's stiff. Very common trigger of occlusal muscle disease. We also have, of course, jaw pain, clicking, popping, but typically we have normal opening, like the disc, the joint works pretty well. So we're not like limited, we're not getting locked jaw, so to speak, but we're seeing signs like tooth wear, excessive tooth wear, and usually clenching and grinding is a large report as well. On our diagnosis, this is kind of what we look for. One, we're going to look for joints that are functioning pretty normally, pretty healthy, and you're able to open normally and so on. Alignment's fairly good. We have little or no temporal pain kind of in this region. So if this muscle's not really bothering you, but it's more of this muscle, it's typically occlusal muscle disease. Poor contacts in the back teeth is a pretty prominent sign of occlusal muscle disease. Pain in that masseter and neck, as I just mentioned, clenching and grinding, and then joints click, but they are in a good position. So on the 3D X-ray, we actually don't see any troubles with the joints, so to speak. In our diagnosis, one of the things that we use here is called a T-scan. So you can kind of see it up here in the corner. It's kind of a little handheld device that we use, and when we have a patient bite on that sensor, it actually shows up in real time on the screen. I have some video kind of showing this in a second. But it allows us to see where you bite, how hard you bite, how you bite and move, and it records all that in real time, so we can actually see which teeth hit, which hit first. Is the right side balanced compared to the left side, and vice versa? Do you bite and it only hits one side, or it hits a couple of teeth first? And then when you slide side to side like you're chewing food, are you just clashing teeth and rocking them side to side? So this T-scan helps us record that, so we have very great data. We know exactly what your bite's up to, so we're not having to guess at whether or not you're suffering from something like that. Let's talk solutions for a second. So what do we do when the bite's not in harmony? Well, one way or another, we have to correct that bite. And so one of the easiest things we do is called a bite optimization. It's just a term I came up with for balancing out your bite. And when the teeth are aligned fairly nicely and we don't really have a gross mismatch of your upper and lower teeth, many times I just have to go through and just create balances and get some of those nuisances out of how your teeth are clashing together, so that when they strike, they're putting forces down the teeth in the proper manner. We call that a bite optimization, and we do it often. This is actually a patient of ours, Avery, that we did this for. She had come in, she had a ton of masseter tension over here. She was getting headaches on that side as well, and popping and clicking, and so just really detriment to her life. And she had mentioned something on Facebook, and I happened to catch it. I was like, Avery, get in here. And so we checked her bite, and that's really all it was. So after 3 visits, she was out of pain. And I just kind of highlighted some of the parts of her review, but she just said, I can't even begin to describe the amount of relief that I feel. No more pain, no more clicking and popping, no more migraines, no more vision issues. The large knot in my masseter muscle is completely gone, and I haven't needed to take a muscle relaxer or a pain medication in weeks. She was kind of living on those. So really fun when it can be something so simple. It's a painless procedure. We'll talk a little bit more about it in just a minute. But that is an awesome solution when that's really all that's giving somebody a hard time. So here's a video of me. As you see, this patient is biting on the sensor, and on the TV you can see in real time that it's showing me where her teeth are hitting. It shows kind of a 3D map of where her teeth are hitting. And so there's the clench again. You can see it lighting up on the TV screen, and it's recording it in real time. So that's really helpful. And here's the benefits. It's a painless and conservative procedure. It's quick. It only takes 3 visits. The relief comes usually after the first one. And we're improving longevity of your teeth, your restorations, as well as, of course, helping you feel better, reducing like cold sensitivity, which is a common complaint with occlusal muscle disease. And the fee is only $1,500. So that is always one of my favorite things to do when a patient's a good candidate for that, because it's simple, relatively, of course, inexpensive, and it offers a lot of relief quickly. I just got a review actually yesterday, so I put that into this as well, and I'll tell that story in just a minute for a patient named Kelly. But that was always one of my favorites. So what do we do when the bite is not close enough? What do we do when the teeth don't touch appropriately? Sometimes the bite is just off enough that we really can't go through and balance that bite without being aggressive at chiseling away the enamel and messing with the enamel. And so for those patients, they become more of a line first mentality, and then we go back through and balance it at the end with our T-scan. And so for a lot of those patients, we're using Invisalign. And that's something that we've been using a lot of, especially recently. We actually started 2 cases today for that reason. And it's amazing how often that we can just align things for the patient, get the smile maybe looking the way that they want to as well, because if it doesn't look right, it's not going to work right. It's my favorite saying, but it's true, because I have to make the teeth look beautiful for them to actually work the way they're designed to work. So many times it's kind of a 2-for-1, where we're aligning the teeth, we're getting them straightened out, we're making them look really, really great, but I'm getting them in a place where I can conservatively then go back through and balance them at the end. And relieve all that muscle strain that the patient's usually trying to get away from. So that improves function and aesthetics, conserves the enamel when we do that first. It improves your foundation, prevents further dentistry. That's kind of key there, is we're saving a lot of damage and wear and tear that just leads to more dentistry down the line. Average time is about 6 to 12 months. For most patients, it's probably closer to like 10 to 12 months, but some quick cases can be closer to 6. And our fee for that is $6,500. So I definitely am not the least expensive, probably Invisalign provider in the area. My goal is not to be, because generally I'm not just trying to straighten teeth. I'm trying to actually fix the bite and correct a lot more things, and T-scan at the end and adjust the harmony and chase you down for a couple of months as things settle. So for us, it's not just straightening a teeth game. That's a pretty simple game for a lot of people, but in our practice, there's a little bit more to it, because we know what straight teeth can sometimes be. And for a lot of people, they have straight teeth, they have a nice smile, but they're actually in a lot of pain. So there is a lot of thought that goes into our case setups that I design, just so I know my patients are getting the best outcome possible. All right, so the last thing I want to talk about with occlusal muscle disease is synthetically correcting the bite. So if we have a patient, for instance, and I had a gentleman named Matt not long ago who was about to move out of town. He was here for about another 30 days. He was like, I don't have time to do Invisalign. I wish I could. And he was not a candidate for just optimizing his bite. They would be too aggressive. And he was a young man. I think he was like 20 years old. And so we didn't want to do that. So in his case, we did what we call a bite splint. This is not a night guard. This is a very definitively designed splint that I have to balance out and put a lot of harmony into it once we get it back again with the same thing, the T-scan. And we're going to deliver that. We're going to balance it out. We're going to go through the same function as if it was your teeth in your mouth. And we're going to now adjust the acrylic on this bite splint instead of your teeth, so we can create the same setup of your bite being in harmony. This is also quick, only takes 2 visits. Relief comes fast, reduces a lot of sensitivity as well, and the fee again is only $1,500. The downside is this just isn't a permanent solution. So it's a quick fix. It binds, it bells people out for a short period of time, but it's not going to be your ultimate quick fix. And I think that for anybody, my hope is that we can always try and get them a solution that's going to fix the problem. I think as a dentist, sometimes feels like my profession is based on patching people up and fixing the problems, but we're never actually fixing the true root core of the problem. We're just patching it. And I tell people all the time, like, I can put new tires on your car, but if your car's wobbly and at 65 and you're wearing the tread off of them, you're getting 5,000 miles instead of 20,000 miles, maybe it makes more sense that we align the wheels and tires, or wheels and the you know what I'm saying. But anyways, they're trying to get the car to go smoothly down the highway so that your tires are not getting premature wear. And I think that's kind of a similar analogy to our teeth. And a lot of times we're spending a lot of money on dentistry, and we're really doing that just because the car's not balanced. The wheels and the tires are not balanced. And so as a result, you're just wearing things out too fast. So this is a great solution. Again, when we need an interim solution, it's just unfortunately doesn't hit the core problem. But sometimes that's what we need to do, and that's why it's there. So at the end of the day, not the end of the world. All right, we're going to jump over here. This is a video of a gentleman, that same gentleman I was just talking about, and this is a video of him actually biting together. You can see how that guides his front teeth and separates his back teeth. So I designed that to be almost exactly like if we had corrected his bite with Invisalign and put his teeth where they were supposed to be. So he's feeling a lot better, but this bought him time because that canine's out of alignment. His back teeth are grabbing each other as he goes sideways. It's creating a lot of nauseous stimulus for his muscles, and he was having headaches and a lot of excessive squeezing here. So his jaws were actually hypertrophying. He's getting like muscles in his jaws right here, which a lot of guys would like. He did not like the appearance of his jaws getting so large because of those muscles being so tense all the time. So anyways, that's a temporary solution there. All right, so that's occlusal muscle disease. Again, the most common thing I see, the most common thing I treat, and easy to do, but one of my favorite things. So we're going to move on now to poor jaw alignment, which is almost just kind of like occlusal muscle disease, but even more severe, so to speak. So I like to read this because when significant effort is required to align the jaws, strain in the system will become evident. I talk to patients a lot about this because overall, this is fixated. Your upper jaw doesn't move. The lower jaw does, and it's almost on a sling of nothing but muscles. And so if you have an upper jaw and a lower jaw that are heavily misaligned, meaning that when the muscles are relaxed, temporalis muscle, masseter muscle, digastrics, when all these muscles are relaxed, if your lower jaw wants to sit in space in a very different position than your upper and lower teeth dictate that it has to align, many times patients will have excessive muscle effort to try to always keep their lower jaw pinned wherever the top jaw dictates that it needs to be, because really you've got to chew and eat, you've got to stay alive. When you have to swallow, right? Everybody has to swallow 2,000 times a day. Well, your teeth have to come together in order for you to brace to do that. So no matter what we do, we have to hold that lower jaw very, very closely to our upper jaw. And it just so happens for a lot of patients, they're taxing their face consistently by having to do that. So important to know in that regard. We're going to jump to this next one, and we're going to talk about the cause for just a second. This is foreshadowing. But I like people to know that development, especially from that age of 4 to 12, is critical because that's when our face is growing the most. And if we don't have great development, it's going to lead to significant misalignment. And that requires that excessive muscle activity to align the bite each and every time the teeth come together. So it's critical that we develop, that our kids develop. That's why we have a whole division here helping our children develop, because we want to make sure that their jaws align well so that we're not just trying to pretty up teeth, but the system, the foundation is still stressed. We see that a lot, and it's unfortunate. All right, so going back to the presentation here, I think I kicked it off. Symptoms of poor alignment. This is going to be a little different from occlusal muscle disease. So number one, we have headaches, and they're typically going to be more in this range of the side, the temporal regions, or they're going to run up the back of the neck and come all the way around to the frontal area here. That's the most common symptom that I see. We're also going to have more clicking, popping, grinding maybe in the joint. We're going to have limited opening, deviation of the jaw. And that just means now the joints are being so affected that when you open, you can't open very far. Or when you do open, it's opening to one side because one disc isn't working very well and it's kind of getting pinned and held up. So we see more opening issues than we do like with occlusal muscle disease. We might see excessive wear of the front teeth. That's really common because a lot of times the lower jaw is so pinned back trying to hang out underneath the top that when the muscles let go and everything kind of relaxes, maybe when it's sleeping, the lower jaw wants to skid forward and it runs into those top teeth, and eventually we start seeing people rub their front teeth kind of flat against each other because of that. So that's kind of a pretty ominous sign that we're dealing with poor jaw alignment. A lot of our patients have history of braces or extractions as well for braces. I was one of those candidates. That was kind of what got me. And then ear symptoms are common as well. Dizziness, ringing of the ears especially, fullness of the ears, and other things like that. So how do we diagnose this? Well, again, we're looking for signs. We talked about the activity here in the temples. Usually looking for a large overbite or underbite. So that may be kind of like this, or real far back, kind of a weak chin is common when we see patients with a really weak chin. That's usually a sign of that. Again, on x-ray, we're looking for a poor position of the joints. We're looking for joint derangements where the jaw's not flowing or moving well and evenly. Maybe the bite's been heavily misaligned or restored for a long time. A lot of work usually in patients like that because they've just been beating their system to death. They're also clenching and grinding, and again, limited opening. So when we diagnose this is a little more critical. We're going to use a 3D x-ray, of course. We're going to look at the joints, and we're going to make sure the joints are looking healthy. So in this picture here, this is actually a good joint, but many a times what we'll see is actually this joint here is, if I can get my Apple Pen to work, sorry guys. A lot of times it's actually pinned back. And so that's something we look for, and we can kind of tell where that joint is aligned in space and if that's part of the problem. The other thing we're going to look at is the EMGs, or electromyography. So this is just a diagnostic test that measures the electrical activity of the muscles and the nerves. This is what we use, and this is kind of a setup very similar to what we use. You can actually kind of see my shadow here. Of course, I'm screwing things up here. Sorry, guys. So you can kind of see my picture over here on the left side, and I've got that on at the moment. But what that does is allows us to run the EMGs and actually read the muscle activity in real time. So when you're just resting your teeth together, we know what a rest muscle looks like. And for a lot of our patients, we'll have them just rest their teeth lightly in touch, and we'll be able to see muscles that are just working extravagantly hard. And so this is what we call neuromuscular dentistry. We're trying to find muscles in a relaxed position. We're trying to read them to see if they are relaxed or they're not relaxed, and that kind of helps us define whether or not a patient is suffering in that regard. Neuromuscular dentistry is kind of like this. This is my overall approach and how I explain it. Most of the time, the teeth are dictating everything. Again, you got to eat, chew, and stay alive, right? So teeth are dictating everything. They get to lead the charge. They boss everything around. So the teeth will dictate where the muscles and the joints work, position themselves, and so on. When we're talking about neuromuscular dentistry, we're really just talking about flipping this pattern around. And we're going to go, hey, let's get the joints in a good position. Let's relax the muscles. And let's find out where the jaw goes in space and where the misalignment of the teeth occurs. And let's record that and try to put the two together. So really it's just turning the game around and going, hey, muscles and joints, what if you had your way for once? And once we do that, we often get to find out exactly where the jaw goes. And I always say, like, we're going to try to find out where your jaw is when it's in neutral. And many a times the lower jaw is not matching up at all or even closely to the top teeth, but it's having to go there and it's working excessively to try to, again, match up the teeth together. And that's where a lot of patients' pain comes in. It's just chronic muscle activity. So our solutions. First thing we always do when we're doing neuromuscular dentistry and we found and diagnosed that a patient's jaw alignment's heavily off, we're going to synthetically treat this. And we're not going to do anything permanent yet. The first thing we're going to do is called a neuromuscular orthotic. And so again, in that process, we're going to use those EMGs. We're going to relax the muscles using TENS units. And I don't want to get into the whole process and make this complicated. But essentially, we're going to relax your muscles. We're going to find out where your jaw goes in space. We're going to capture the difference between where your jaw wants to be versus where it has to be. And then we're going to create this orthotic that when you snap onto your bottom teeth, it's going to align your jaw now into that neutral position. And so this is a picture of one. Hopefully I won't screw up this again with my iPad. If I do, I apologize, guys. But this is a splint here where you can see that when that jaw is in a neutral position, all of that space occurs between the back teeth. So the jaw came down and forward, and with this neuromuscular splint and the patient biting on it, they can now rest confidently in that spot, and they can wear this 24/7, chew in it, eat in it, you name it. And as they do, it's almost like we just flip the switch, put their bite in a better position, all those muscles relax, and now the patient usually gets tremendous relief in a very short period of time. So one of the neatest things that we use in dentistry when we have patients that are suffering from TMD. The next phase is, okay, well, now we've got you feeling better. You've been wearing your orthotic. You're doing great. What do we do now? Well, that's a various solution because every patient's different, and it typically comes down to these different options. So one might be expansion of braces. So we might have to really do some heavier work to align the jaws using some appliances, expanding the arches, you name it, and then using braces to restore the bite in that position. Other time, we might find that, again, kind of like that orthotic you just saw in this previous picture, maybe that's what the patient's bite ends up looking like, and if it does, then maybe we can just go through here and we just build the teeth up on the bottom using some ceramic restorations, and all of a sudden now the bite is back together again. So that's another option. Full mouth restorations is another common option. We probably do one of those, maybe a month, where we're rebuilding the entire bite so a patient gets all that relief. And most of our full mouth restorations are for patients that have been living in pain. I myself have had my mouth restored for that very reason. So that's a common one as well. And then many times it's a combination of those approaches. So that's common too. Fee ranges. Fees usually between around $8,500 for expansion of braces up to about $60,000. And I know that sounds absolutely crazy, but it's about the price of a car for a lot of people. But to live completely pain-free again and to be themselves again, many times that's worth it. And then the cost of that goes into the technology, into the lab fees, into the expertise of properly designing the case and getting the bite just dialed in. And it's not a short process. It's usually a 6-month process or so, maybe sometimes more. But patients are doing this all over the United States commonly, and for the reason of just needing to get relief. And so those are cases that are generally also like a 2-for-1, where a patient's had a lot of work, a lot of breakdown, their jaws are misaligned. And I have some patients to review with you over that we've done this for, but it's generally not like a healthy person with healthy teeth and we're going to prep them and build up all their teeth again. It's generally people that are in their 40s and 50s and 60s that have had a lot of damage, a lot of change, and now they're needing a better solution. So keep that in mind. That's not something that every patient coming in for TMD consultation needs to be thinking, oh my gosh, it's going to be $60,000. That is probably 1 out of 30 people, 1 out of 20 people, maybe max. So keep that in mind as well. All right, so that's poor jaw alignment. We kind of talked about the solutions there. And then the last thing I want to go over is probably one of the most important, to be honest with you, and this is myofunctional disorders. And I know that's a term that most people don't know about, but myofunctional disorders are rampant in our country. We have a whole division and 2 trained therapists that actually help treat adults and children to get the patterns corrected. So let's talk about myofunctional disorders and what that is. So I think I might have skipped one. No, we're going to stay here. All right, so myofunctional disorders are just conditions affecting the muscles and the functions of the face, the mouth, the throat, and potentially impacting the breathing, the chewing, the swallowing, and speech. This is a busy slide that I don't love. I don't know why I created so much text to it. I apologize. But let me just summarize it by saying the goal of all of this is to make sure the patient is breathing through their nose, keeping their lips together, the tongue is in the roof of the mouth resting, they're swallowing properly by putting the tongue in the roof of the mouth and butterflying against the roof of the mouth. And those are the most common main 4 things that we're trying to accomplish. Now, anything that deviates from that, where a patient swallows and presses against their teeth, or is an open mouth breather, meaning they breathe through their mouth all the time, things like that, there's a million different kind of nuances to these patterns, but overall, they're essential for the function of our face to be healthy and feel good because like when we have disorders of our facial muscles and our swallowing muscles and so on, it actually creates a lot of strain in the system, makes a lot of the pain problems even worse. Secondly, it's very important to get these corrected when you're young, between that 4 and 12 age, because this is highly involved in the facial development. So when the muscles are off, the breathing patterns are off, and we're breathing through our mouth versus our nose, our face completely changes in terms of its development, meaning the bone follows that soft tissue change and the muscle change. So this is something that follows people their whole life. It doesn't just happen, for kids. It's not just part of well, I want to say this. It's the most underrated thing that we treat, and it's the most offered thing, I think, in our country when it comes to dentistry, because it affects your overall health, but it affects your teeth and it affects your face and your muscles and how everything works together in harmony. And it's critical to get right. So for a lot of our patients that are suffering from myofunctional disorders, it's the reason they're in pain. It's the underlying causation behind a lot of these things that we're talking about solving. And so many of our patients will actually go through therapy and work on these things while we're also treating those other issues. So the main causes: mouth breathing, thumb sucking, and oral habits as children. Tongue ties are a really popular one that I see that that people are missing. And as a result, that tongue is held down. It can't function properly, and it changes the pressures and the dynamics within the mouth. Malocclusion or bad bite is often responsible for other activities that kind of compensate for that. Poor swallowing patterns, softer diets for sure in our country. We just don't have enough resistance on our bite, so we're developing the wrong habits because we're not developing the strong patterns of swallowing and the strong patterns of chewing the way we're supposed to. And then airway restrictions, maybe like large tonsils or deviated septums, is another causation of a lot of myofunctional disorders as well. So symptoms of myofunctional disorders, we're going to see a lot of mouth breathing, tongue thrust. Tongue thrust is important. This is probably one of the most common reasons I see a lot of TMD. And here's an example, and this is actually one of our patients. This space here occurred. This patient had braces when she was younger. All this opened up because that tongue presses through her teeth each time she swallows. And over time, I always say you're just kind of like opening the garage doors. It pushes those front teeth apart. And when that happens, now we've lost our front teeth as guides. The back teeth now are just getting hammered, and it triggers usually TMD concerns and headaches and jaw pain, clenching, grinding are generally always found in patients like this. So this just shows, and I like this picture because it shows the power of the tongue, and if it's not done, or if it's not swallowing correctly and not being used correctly, your muscles will always win. And I remember in dental school, they talked a lot about that, and they said, hey, listen, when it comes down to, function, muscles win every single time. Muscles will change bones, muscles will move bones. It doesn't matter what happens. Like if you're building muscle as a bodybuilder, you're building bigger bones. Like the muscles dictate what the bones do. And in the case of a mouth, it's no different. Your teeth will follow the bone movement. Or I should say the bone and the teeth will follow your muscle movement every single time. And people don't give enough credit to that part of it. But that's huge. So how you're functioning daily is imperative. And the other thing I'll mention too, I know I'm probably now spilling off. This is just the coffee talking. But when our patients have a reverse swallow, or a tongue thrust is another word for it here like this, when they swallow and they press against their teeth, there's usually a reverse or reciprocal pattern of balance. So they'll actually purse their lips together. They'll use different muscles, and they'll actually put so much force on the front of their teeth to counteract the tongue being pressed through their teeth or on the back of their teeth, that it actually causes the jaw to be pressed backwards. And I've got some research papers that have shown that disc becomes stressed and generally damaged over time from a swallow like that, because we're constantly making the jaw force backwards every time we swallow. So it's little things, but man, they add up. And so with our patients here that are here for TMD, we're often looking at those things because that's kind of the critical underlying issue for a lot of our patients that got them here. So when we're diagnosing this, we're looking for the presence or absence of a lot of different findings. And again, I mentioned that we have 2 myofunctional therapists. I have Candace DeHughes, who's a registered dental hygienist and a myofunctional therapist, as well as Lisa Pass. They have both been with me since we opened this practice in 2016. Amazing women, blessed to have them, and they are fantastic at what they do. And so love when a patient works with them and has a wonderful experience, because it changes a lot of lives. So myofunctional therapy, here's kind of the solution. This is kind of what it is. It's exercise for your mouth and your face. Helps train your tongue, your lips, and the jaw to work in the right way so you can breathe, chew, and speak better, more harmoniously, and with less muscle strain, I might add. So when we're doing a consultation for myofunctional therapy, we're going to go through just the examination, a comprehensive review with Candace or Lisa. We develop a treatment plan based on you because you're different than the next person and the next person. So we're going to have a customized treatment plan to address the exact findings that we have for you. We're generally just going to be doing 30-minute sessions. They're in person. Most of them for adults, for instance, is in virtual consultations. So that may be every 2 weeks. You'll check in. You'll do a FaceTime with Candace or Lisa, and they'll go over the next session of exercises, the next session of work with you. But an easy process, just consistently, because we're trying to change the neurology of how you function. And so it just takes time and it takes consistency, and that's part of the therapy as well. And then at the end, we just review the findings to make sure that you got those things corrected and that you have new muscle patterns to restore your balance. So those are the three main causes: occlusal muscle disease, poor jaw alignment, and of course, myofunctional disorders. And again, in that order, I kind of put them in this order. Myofunctional disorders is definitely not the third most common. It's kind of an underlying reason for almost everything. So it's something that kind of becomes involved in just about everything that we do. Want to stress that again. All right, so going back to the roadmap, we've now talked about what TMD is. We talked about the three main causes. Now we're going to talk about case studies. I'm going to go through some cases and how we treated them, and then we'll get to those FAQs. So this is a patient from, I got this review yesterday, and it's worth reading in entirety because this is a patient that we did a bite optimization for. But she came in because she was in so much pain. She's been with me for years, and she called one day and she was like, I got an infected tooth. I need to come see Dr. Smith. So this is her review that she sent me, and she's a lovely, lovely gal, and I'm so thankful for her, and I'm so glad she let me treat her. But she said, I came to Dr. Jordan Smith in severe pain, convinced I had an abscess due to an aching in my teeth and my jaw. And to my surprise, Dr. Smith diagnosed me with TMJ, which again is kind of layman for TMD or TMJ disorder, explaining that my bite was unbalanced and causing the symptoms. We just used a T-scan, and we found that she was having a lot of conflicts on the side that she was in pain on. So she said, I admit I was very skeptical, but the pain was so intense, I had to believe it could be, it was hard to believe it could be anything other than a dental infection. We all know how painful that can be. Still, I agreed to start treatment, hoping for even the slightest relief, but after the first session, the pain actually got worse due to the jaw adjustments involved. And she called the next day and she was like, I'm worse off than I was when we started. And I said, that's perfectly okay. And the reason is because she was already in pain. We started the procedure that day. So I had her opening and shutting and biting on my T-scan and making adjustments and open and biting again and making more adjustments. And I did that for about 30, 40 minutes. So she already had a lot of muscle tension, and then I aggravated it for 30 or 40 minutes. But it's almost like getting the splinter out of your hand. It's irritated already. When you pick at it, it doesn't always feel good, but the second you get it out, it begins to heal just like that. So she started treatment, hoping for even the slightest relief. After the first session, the pain actually got worse due to the jaw adjustments involved. Again, I doubted the diagnosis. Dr. Smith calmly assured me this was completely normal and temporary. To my amazement, by the next morning, the pain had decreased by about 85 to 90%, and it continued to improve from there. Today, I'm completely pain-free. And I won't read how she commends, but ultimately, awesome case. And it was one of those slam dunk cases where I'm like, this is going to sound crazy, but it's just the way your teeth are aligned. You're beating them up. It's driving your muscles crazy. And so that's another fun one. Another patient of mine, a nurse here named Robin, sweet gal. She said, I had a great experience. I had severe TMJ. Along with that came a lot of migraines, sometimes 5 to 6 times a month. Getting down to the bottom, just says pain is gone. I don't have migraines anymore. And I love that for her because she suffered kind of needlessly for a long time, just not knowing that. And I remember her bite was completely off. So when we ran the T-scan, one side was like 80%. All the force was on one side and not the other. So when she bit together, the right side hit first. Then she had to really bite hard to get the left side together, and it was just exacerbating how much muscle activity was involved in that left side. So we just balanced out her entire bite until we got to 50% and just watched her to make sure it stayed that way. And she, she stabilized there, and that was all we needed to do for her as well. And Miss Erin, same thing, just a bite adjustment. And I'll just read the pink part. She said, I no longer have tension in my jaws, causing headaches, and my teeth grinding has stopped. I didn't realize how much pain I was constantly, how much pain I was in constantly, or the annoyance it was bringing to my life. I can't tell you how many times I've heard that where a patient has said, I didn't even know how much pain I was in until I was out of pain. And I'm always glad to hear that, but I always hate that people are suffering and they don't know that there's relief and that it can be this easy. So again, all we did for Erin was just another bite optimization. Painless procedure, took 3 visits, feeling great. Here's a case where we actually did a neuromuscular sprint. This is a friend of mine, he's a firefighter, but was having a lot of tooth wear. We were kind of concerned with the longevity of his mouth and talked about a full mouth maybe in the future, but for now, again, wants to buy some time. So we made Trent a neuromuscular orthotic, and he came to me and said, I didn't even realize I slept bad or I was in discomfort until it was corrected. He really just wanted to make sure his teeth were okay and they weren't getting further damaged, and we realized there was a lot more kind of underlying his concerns, and he was suffering more than he really kind of thought or led on to. And I like this last line: you don't notice the pain or discomfort sometimes until you see what it's like to go without it. So kind of echoing Aaron's story here. And another lovely lady, Miss Christie, one of my favorites. And for her, we did a neuromuscular orthotic and got her feeling better. And then we did expansion and braces. So kind of a multi-modality thing like we mentioned earlier. And her quote, just, before my treatment, I woke up every day with jaw pain and migraines due to my TMJ. She was getting a lot of Botox in the past. She was doing everything she could. And I remember her muscles here. She just had kind of this square jawline because her muscles are so large and so active all the time. And in this bottom area, she says that decision for basically treatment was quite literally life-changing for me. I no longer wake up in pain, nor do I have to deal with the daily morning migraines my TMJ caused. She's been like one of our greatest fans, and I love her to death. Amazing gal, but just every time she comes in, she's just superbly lit up and excited. And anyway, so game changer, one of those cases. You just don't forget those kind of cases. She's absolutely wonderful. Another one, Mr. Eric. This is, again, another multimodality case. So Eric was having a lot of symptoms, and for him, we did expansion and braces. After that, I put him in a neuromuscular orthotic to kind of figure out exactly where his jaw wanted to align. And then for him, he was kind of unhappy with his smile. His skeletal structure was off just enough. It was really getting hard to kind of finish his case with braces. And, we could have. I just kind of floated the idea. I said, you mentioned you didn't always like your smile. What do you think about just building your smile together? And that way I can just build your bite right where it needs to be. And he said, man, sign me up. Let's do that. So that's what we did. And his case is powerful. We just posted his video, I think 2 or 3 days ago. So you can see that on our Facebook page. But he said, I was waking up in pain every morning from muscle tightness throughout my face, neck, and abdomen. We get down at the bottom. He says, the pain and tension's now gone. I'm sleeping better without a CPAP, and my posture is greatly improved. It's truly been life-impacting treatment. So thankful for Eric. I loved his video. If you haven't seen it on our Facebook page, I think we posted it maybe yesterday or the day before. So check that out, but that's another good one. Here's a case where we did, again, multiple modalities, but in her scenario, we did a neuromuscular orthotic, did expansion and braces, and then for her, we actually built up those bottom teeth because, her jaw alignment, even after expansion and braces, her lower jaw just wanted more. It wanted to come forward even more to be in that neutral position. And so after looking at that, we kind of met our limit on what we could expand on the top arch, and skeletally, she just needed a little bit more. So we realized that if we built up her back teeth, problem solved. So that's what we did for hers. We just put some ceramic restorations just right on top of her teeth. We hardly touched her teeth at all. And we just built them up so that the space would match up based on where her jaw was in neutral. She had kind of a gap between her back teeth, so we just built them up with some ceramic. And you wouldn't even know that they're on there. They blend seamlessly. So another fun case with Miss Kathleen. And Miss Karen, we did a neuromuscular orthotic. She had a collapsed bite. A lot of issues. This one's interesting. She had some infections, some other things, but she said, actually, I believe it saved my life. She was worried about infection. She was suffering from a lot of headaches and mouth pain. And, this is one of those cases where, again, patient just had a lot of dentistry. A lot of it was failing. And so we were able to kind of go back through and just renovate the house and make it all new again. And we built her bite into a good position instead of the bite she was in, which wouldn't have probably lasted long even if we rebuilt her in that position. So these are really important cases to build right and get the bite in the right spot. Otherwise, a lot of damage occurs needlessly, and restorations don't always last. Case studies. We're going to talk about that for just a quick second with Miss Elizabeth. Sorry, I'm just checking to make sure everything's still running, so I'm probably not making sense when I say that. Last one here with multiple modalities. So another one we did a neuromuscular splint with, and then we did veneers and crowns. So we rebuilt her bite as well. She said, when I first went to Dr. Smith, I was in extreme pain from my TMJ. It was so severe I was struggling to even eat some days. I was not willing to live with chronic pain that made it impossible for me to enjoy my life. Once Dr. Smith explained the entire process to me, I was all in. It's so nice now to not have to worry about popping, clicking, and shooting pain. My jaw no longer locks up, and I am pain-free. Thanks, Dr. Smith, for fixing my bite so I can enjoy eating and enjoy life again. Man, that's why I do what I do. God, I love these cases. It is something that I've experienced firsthand. I've lived it. I know exactly how Elizabeth feels, and to know that she's just out there enjoying life and eating what she wants and enjoying, restaurants again and going anywhere she wants without thinking about it is, it's a joy that I love about my work. So very thankful for her. So those are the case studies. And then lastly, we'll jump into some frequently asked questions. I know this comes up a lot on the phone with our front desk. How much does a consultation cost? So generally, there's going to be several parts of this. We're going to take a CBC 3D X-ray. So that's a big part of it. Digital bite scan so we can read your teeth. Again, with that T-scan, we're going to do a digital model. So we're going to scan it with an iTero instrument that's going to allow us to actually see it on the screen in 3D so we can kind of look at your bite together helps you just understand it more than anything. And then we're going to read the muscles and see what they're doing, how they're firing, and then we're going to do a physical exam just to see what muscles are tender, what muscles are hurting, and how your jaw is working and if it's opening correctly and doing its thing. Normally it's about $482 for that consultation and that hour of time that we're going to go through and pull all that up. We sometimes have even 2 hours just to make sure that we're checking everything properly. If you watch this webinar, I'm going to give you a special. It's $225 for consultation if you're watching this webinar, so feel free to mention that if you've seen this, because if you did, you're going to save a little more than half. So please do that. And another question, does Botox help? Yeah, it can help. It's something that's becoming more common, unfortunately, and I say unfortunately because we don't have enough providers to treat the actual problem. But whenever your muscles are chronically tense because they're chronically activated, all you have to do is numb them up with Botox, right? It kind of works. I mean, it just, all it does is it's a neurotoxin. It freezes the muscle, stops it from contracting, so your lactic acid doesn't build up in the muscles, and that's what causes the pain. The problem is it's not a fix. It's just a patch. So I think, again, I've gone back to what I said earlier. I don't like patches. So if somebody is just getting Botox and thinks that's the solution, it's a pretty expensive solution if you have to do that every 3 months for the rest of your life. I mean, what do you, I look at these things and I'm like, man, that adds up to tens of thousands of dollars in 20 or 30 years time. And you have to go in and get shots in your face every 3 months, So is it a solution? Yeah, I suppose it's a way to get out of pain, but it's not a solution. I hope that makes sense. The biggest question, does insurance cover TMD therapy? That's a frustrating one because they should, but most of the time they don't. Now, if we're going to do things like braces, they're going to kick in if you have coverage for orthodontics. But in most cases, when it comes to like orthotics or bite optimizations or full mouth makeovers or whatever it may be, medical and dentistry kind of just keep pointing the finger at each other and going, no, TMD is medical, and medical says, no, TMD, that's teeth, that's jaws. And so for the longest time, they've all just kind of skipped out on being able to be responsible for it. Now, I say that we've had several patients that have filled out the paperwork and have filed it with their medical, and they have gotten coverage for things that we've done. So we're always willing to write down everything that we're diagnosing and finding and the coding and et cetera. So we're always willing to facilitate that and help you along. We don't work with medical. We typically don't need to. But overall, it's a question that I think is fair to ask, and we're always willing to support you guys. So keep that in mind. But unfortunately, TMD falls into this donut hole of not our responsibility, is what I always say they quote. And every doctor that does TMD is frustrated by that. So just so you know, I get you, because I just want to help more people. So I'd love it if your medical would help. But yeah, they can be boogers sometimes. Can I do anything at home to help? I mean, your typical stuff. So you're going to be doing, NSAIDs like Advil or Tylenol are best over-the-counter options. Muscle relaxers can help, but again, it's acute pain or acute help. It's not going to be a fix. You certainly don't want to be on muscle relaxers your whole life. I do recommend avoid the homemade splints. There's always a price to pay for a boil and bite or just a splint that you shove in. There's generally always a price to pay. Teeth will move over time with those. It's usually not a good thing. If it's rubbery, it'll oftentimes fire the muscles up more because you'll find ways of tweaking the teeth in a way that we talked about, kind of causing occlusal muscle disease. So I don't recommend over-the-counter splints. Head and neck massages can actually help quite a bit and relieve that tension. So again, it's not a fix. It's kind of like the Botox. But if you are suffering head and neck pain, then I think that's a great adjunct to your life. Even sometimes through therapy, I'm recommending that just so patients can have more relief as we're getting them on the path of to correction and freedom. So that's one other thing there. But overall, that is the webinar roadmap and what we accomplished. So the last thing I want to go over is just what do you do? If you're suffering right now and you're like, man, I think I have occlusal muscle disease, or maybe my jaws aren't aligned and I don't really know what to do, schedule a consultation. Please come and tell me your story. We'll dive into what it is you're experiencing. We'll give you some hope. We'll talk about what we can do to help. We're going to review the options. We're going to talk about short-term, long-term options. We don't have a one-size-fits-all here. We are certainly not a practice that's here to push you into any kind of treatment. Our goal is to completely support you in any way we can. So clinically, I want to make sure I give you every option that I can possibly come up with. Financially, we'll go over everything to give you as many options to make sure it's affordable. We get to do this for a lot of patients, so I'm confident we can do it for you all as well. But lastly, we just begin. So it's always exciting to see somebody start the new journey of TMD relief, like we started another one today. So always fun to help in that regard. I want to thank you guys for watching. If you did, I think I see a couple people are live streaming and watching, and I really appreciate you all doing so. And I'll be trying to do this again once a month. So if you have any comments, any thoughts that you want to offer, please please throw them in the comments below this if you've watched it. Doesn't matter when you watched it, whether it was live or you're watching this recording. Please leave a comment. I will keep an eye on that. I will answer as many questions as I possibly can. Again, I'm Dr. Smith here at Breathe Modern Dentistry. I want to thank you for your time. I'm going to finish my coffee. I'm going to grab some sushi. I'm going to head home to my family, and I hope you guys have a wonderful, wonderful, wonderful night. Thank you, guys.